What comes to mind when we think of a disaster, a catastrophe, a global crisis? Whatever we may have imagined just a few years ago is likely now replaced with different images. Disaster-associated morbidity and mortality are exacerbated in homeless populations due to an increased need for emergency shelter and thus more crowded conditions, interruptions in vital community and health services, and funding constraints. Shelters must often prioritize housing and food security over disaster preparedness, while the population they serve is frequently neglected in community disaster planning. The novel coronavirus pandemic has both increased the need for shelter services and decreased the availability of staff and volunteers, straining an already overextended system. Individuals in 3 homeless shelters participated in this cross-sectional study via a quantitative and qualitative survey in April 2020, 1 month after the first case of COVID-19 was reported in Dallas County. Homeless shelters have instituted distancing rules with floor markings, mask requirements, restrictions on visitation, upgraded sanitation and cleaning efforts. In addition, shelters have prepared isolation areas, procedures for symptom surveillance, and options for testing or medical care. Our findings mirror these efforts and indicate high levels of awareness regarding the novel coronavirus, as 25% of respondents answered 80% of knowledge-based questions correctly, and 50% answered 60% of knowledge-based questions correctly. Along with high knowledge-based question scores, relatively high levels of awareness were evident through open-ended responses, in which 27% referenced public health guidelines or precautions, and 21% discussed high density and higher turnover rates as major risk factors for shelter residents. Higher knowledge scores directly correlated with higher levels of reported stress, indicating that overall low levels of stress could be due to gaps in knowledge or understanding. Higher stress and higher knowledge scores were seen in those with shorter lengths of stay, which may represent a more acute transition into homelessness. Despite much higher scores regarding COVID-specific precautions, the lower rate of more general health literacy demonstrates an area for improvement. This is especially vital as approximately half of respondents reported taking medications for the very conditions that place them at greater morbidity and mortality risk for not only coronavirus, but a multitude of illnesses due to impaired immune function. While over half reported an interest in receiving a COVID-19 vaccine, a smaller proportion reported an increased interest in receiving a flu vaccine following the emergence of COVID-19. A significant portion of those interested in a COVID-19 vaccine or flu vaccine were between the ages of 50 and 69. Knowledge scores, stratified by race and ethnicity, follow the general trend of educational achievement in the United States. Along with scoring the lowest on knowledge, Black individuals composed a majority of those surveyed and reported the lowest average interest in receiving a COVID-19 or influenza vaccine. The trend of vaccination interest may stem from an ingrained suspicion of government research and pharmaceuticals, following a long history of unethical and exploitive research involving the Black community, such as the Tuskegee syphilis study, as well as contemporary racial disparities in healthcare. Such racial disparities in health literacy and the need for reconciliation concerning historical mistreatment should be addressed in future response planning and health education efforts, especially those geared towards individuals experiencing homelessness. From the establishment of community partners for rehousing those of highest risk to strong adherence to precautionary principles, the participating shelters generated an impressive response in the face of the pandemic. The communication strategies chiefly responsible for the heightened COVID-19 literacy among our respondents are of particular importance, as shelters have become a primary source of education for those experiencing homelessness. Despite the establishment of various systems to address the healthcare and general needs of the homeless population, shelters and their volunteer base have in large part managed the provision and coordination of such services. This multifaceted role, along with their efficacy regarding the circulation of both COVID-19 information and resources, may serve as a model for more robust diffusion of public health communication and practices outside the context of a pandemic, in order to maximize health literacy of the population they serve.